Isn't anybody can put it simply? Well, welcome to this show, Health Simplified, a simple guide to a healthier life with the doctor who helps us figure it all out, Dr. Justin Fesler. Welcome, sir.
Thank you, Paul. How you doing?
I'm always intrigued at this show because we get so much confusing information or so much misinformation or so much technical information that at the end of the day, I find everybody saying to me, yeah, but how does that feel? Do we trust that? Do we believe that?
Yep.
And I think that's what this show is meant to be, is giving people, you do talk technically. You're going to talk about some technical stuff today, but in a way that hopefully we can all understand and then act upon here.
I'll do my best.
Okay. And you're mostly, because you do physical therapy, what I'm always amazed is how deeply you go into the rest of the body here. I would think, come on in, we'll make you lift some weights, we'll make you do a few exercises next. But you seem to take a much more holistic and in-depth approach. Maybe because you're a real doctor of physical therapy and you went to USC and a big school and all this stuff. But whatever it is, you seem to understand and delve deeper than the physical therapists I've used in the past, where it was really just kind of a couple exercises and I didn't really understand what we're doing or why.
Yeah. So I think it's happened kind of organically as far as that, if we just touch on that for a second, that you get questions over the years from patients that are, confused about exactly those things you talked about, different aspects of health or what to do for these things. And so I just would do my best and due diligence. And if I didn't know the answer, I'd try to do some research. And it wasn't stuff that I necessarily knew to start with. But you just, you can get some resources and maybe talk to doctors and get the best information possible to eliminate some of that confusion that people have.
I appreciate because in a world of modern medicine, we're dealing with specialists. I'm here to deal with my knee. I don't understand the rest of how it fits into your body or your heart or your this or whatever. So they're very narrowly focused on that. I sometimes wonder, but isn't that an indication that there's something else going on in my body here? Well, that's not up to me. I'm here to fix this thing. And then the other problem is they get 5 minutes, which is very unusual. I've used your services. You don't give people 5 minutes.
Yeah, typical doctor's offices, you're looking at maybe 5 to 10 minutes, and we do a 40-minute one-on-one session.
Right. So you get a chance to not only get to know the patient better and look into it better, but maybe answer some questions.
Yeah, exactly. So I'd like to also acknowledge Juneteenth.
Yes,
today.
That's we're streaming this live on Juneteenth.
Yeah.
Thank you for all those. When the day that the Civil War, slavery finally was extinguished in the last southern state, I think it was Texas or something.
Yeah, which was 2 years after the Emancipation
I
Proclamation,
didn't know that
which
until
is awful.
Right.
So, hundreds of thousands of people lived in slavery when they could have been free during that time period. So I think it's very important to acknowledge these things and, any efforts towards, greater equality in our
And I acknowledge
country.
I grew up in, kind of white middle-class America. I never heard of June to this date that was quietly celebrated or loudly celebrated in parts of the old South and the Confederacy here, and I'm glad that they have finally brought it forward to acknowledge. Even after the war is over, it still took a while to extinguish all this.
A couple years, wow, yeah. Crazy. Anyway, so I just wanted to say that.
Okay.
Dedicating the show to that today. So
good. All right. So today you're going to go kind of technical. I may kind of chase you a little bit and say, what?
So I'm going to try to run through the technical stuff quickly. We're just going to look at NSAIDs and tissue healing. So NSAIDs are non-steroidal anti-inflammatory drugs.
Okay.
People might know these as, let's see, a couple are Advil, ibuprofen.
Really? Those are?
all those are anti-inflammatory, non-steroidal anti-inflammatory drugs. These are over-the-counter things that you can get. There's
as opposed to the steroidal ones that the doctor would give you if it's something really severe. Yeah, so for some like sinus infections or something, so sometimes you'll get that for that. So I just wanted to review a little bit of, there's obviously some goods that come with that. It helps your pain, and maybe it can help with some, you take it here and there, it's probably okay, but we want to make sure that we're understanding what that's actually doing in our body. Before you go there, explain to me why the world moved away from aspirin, which is a different product, which had certain byproducts or side effects.
Yeah.
And everybody now, every doctor I know says, don't take whatever brand aspirin.
Right.
Take something more like Advil or Tylenol.
So I think they're seeing, so these are more, so if you have an inflammatory issue, and if you look at a lot of the uses for these, for dental, after dental procedures and stuff, people are taking, NSAIDs combined with maybe some Tylenol or something like that in high doses just for a couple days. So it's meant to be used just for a couple of days. But what's happened over the time is that these drugs are being used by people daily to address things like pain, where there might not even be inflammation, and they're just using it as like a pain reliever because they don't want to do opioids, which is probably something they want to avoid too. But
and I've even heard people, maybe this is beyond the scope of what we're going to talk about. Some people are using it as preventative thing, like heart disease. I'm going to take a little.
So that'd be aspirin. Yes.
Aspirin. Okay.
So these would not. I don't think I've heard that these have been recommended for that purpose. That's more, I think, aspirin, like a baby aspirin, people would take because it thins your blood a little bit.
Right.
Yeah.
Okay.
So basically, I'm just going to go through which ones they are, which medications we're talking about here, and then kind of go into some of the issues that we might come across in terms of tissue healing as well.
Okay.
So as we said, Advil and Motrin, the naproxen or Aleve, that's the same thing. So and then Voltaren or diclofenac. So those are the main anti-inflammatory medications.
So there's always a product name like Aleve, but underneath it is some other
ibuprofen is the drug, and then Advil is like the brand. Exactly. Right. Yeah. So those are the main ones you're going to come across. As far as let's look at how these medications, usually they're used for pain, or maybe you sprain your ankle, you take some Advil because it hurts, or sometimes people take it for headaches or whatever. But when you're in the tissue healing phase, which is that initial insult, so you have an acute injury that just happened, right?
Right.
You have a cascade of events that happens in your body. That's a good thing, that all these healing chemicals rush into the area. Some of those are, like stem cells and fibroblasts, osteocytes, all these things that help you to heal whatever tissues have been damaged. When you take an anti-inflammatory, an NSAID like this, what you're doing is cutting that process. So you're eliminating a lot of that inflammation that happens. So does it feel better? It does feel better. But how's it going to affect the long term? So I'm going to go through some of those things from studies here.
And I'll stop you for one more second. So inflammation is the body's indication that there's something wrong, right?
Yeah, it's your body's reaction. So if you break something, inflammation occurs because your body is sending healing chemicals to the area. So your body doesn't just cause inflammation for the sake of inflammation.
Right.
Although there are some chronic cases where that can happen with poor circulation and stuff like that.
And then the inflammation somehow is a result of summoning body's resources to that site.
Yes, the body's sending all these chemicals to the area, and they occupy space, so they cause inflammation. So there's if you inject someone with fluids of some kind, it's going to occupy that space and cause inflammation in the area. So I'm just going to go through, we'll look at bone healing.
Okay.
So this is looking at a few studies and what NSAIDs do to that. So a meta-analysis, which is a big study, it's like the top tier of evidence. NSAIDs increase delayed bone healing, so delays bone healing by 107%.
What?
So if you have a fracture or something, you don't want to take NSAIDs during that initial time, at least for like 6 weeks.
Even though it hurts, you're going to delay the body's healing.
You need to just kind of suck it up. You want the thing that helps a bone feel the best is just to put a cast on it, or to immobilize it and make sure that you're not moving it, and it'll feel better within usually within hours, really. So basically, NSAIDs, what happens is it blocks the prostaglandins, which is needed for bone formation. So prostaglandins is our body's chemical that the body creates to help heal bones. And when you take the NSAID, it eliminates that, and so you're not going to get the same bone healing that you would. So
I did not, and yet I would think if I broke something, my wrist or sprained it, you're going to go take some of these NSAIDs.
So Tylenol would be better. Yeah, because Tylenol won't have that same effect on it if you want just pain relief.
Right.
Yeah. So then we'll look at soft tissue healing. So this is like you're looking at tendons, ligaments, muscles, those kinds of things. So the research findings for that, there was a systematic review of 44 studies. So it's a big review. So COX-2 selective inhibitors like Celebrex, which is that's more of a prescription based. So it's not something you can get in the store, but it's the same kind of medication. had a negative impact on soft tissue healing. So they're seeing that the soft tissues, like the ligaments and tendons and muscles and stuff, aren't healing as well because it's eliminating some of that inflammation that you need to heal. All those healing components are in that. If you don't have them, then you're not going to heal well. And then another study showed that ibuprofen interfered with Achilles tendon healing. This is in mice, preventing normal repair processes. So a lot of those things that we see in the blood that are normally helping us to heal are eliminated when you take an NSAID. So that's,
my goodness.
So especially during those, so for those first, 3 to 6 weeks or so, you want to definitely avoid taking an NSAID when you have like a tissue damage kind of issue.
Now, what you're telling me, I've never heard. I haven't had a lot of tissue or muscle or bones break.
Right.
But when I have, they're always like, unless you want to take something like, what's the one we're all trying to stay away from? Opioids and stuff here that really knock out the pain, but you can get hooked on them.
Yeah.
Unless you go that far,
yeah,
they usually just kind of say in emergency room or whatever, just take it as needed.
Yeah. So,
but you're saying actually aspirin would be better than the.
So Tylenol type thing would be a good alternative. And then, there's other topical things that might be better too that we can go through. And then wound and skin healing, same thing. The research says that NSAIDs can delay wound healing by interfering with inflammation, which is actually needed for healing. So a lot of these things, we're just looking at how these NSAIDs affect our body's ability to send the proper chemicals into the area to help heal.
So when people come to you after they've already been to a doctor and they're trying to recover their muscles, their movement, they've had a hip replacement, they've had something here, and they want to get up and get moving again and get past the pain and get active again and get it functioning again. Do you ask them if they're taking NSAIDs?
I do, yeah. Because a lot of people, there are side effects and risks that I can go through right now with you too, especially for people. We see a lot of middle-aged to older population. So,
why is everybody looking at me when you say older?
Well, they're all looking at you anyway. So this is again from a systematic review. I'm just saying that because it's a large study.
Right.
So for elderly NSAID use. So this looked at 50,000 patients that were 60 and over. The finding was that they had increased gastrointestinal, cardiovascular, and kidney toxicity.
Ooh.
So the recommendation would be to use as little as possible for the shortest time as possible in this population.
Wow. And I know people, because I'm in that population, friends, family, or whatever, who take it a lot.
Yeah.
Because things ache and hurt and whatever, so that's their way to manage it and get through it.
Yeah, and if you have people that are elderly and on a lot of medications, then it even complicates a lot of how those medications work and can be detrimental for those reasons too, and is hard on your kidneys. So, and then there's also, the next thing is cardiovascular risks. So studies also show that there's increased heart attack and stroke risk, especially with long-term use.
Oh my
So if people are taking these consistently, it's actually increasing their risk of heart attack and stroke.
Yikes.
Yeah, I know.
So where does it say that on the package, or where does anybody tell me? Because it's over the counter. I can just go get it. It's the everyday way to handle stuff.
But there's a lot of, over time, there's, people have issues and people die of these if they take too much. It's possible to overdose. So,
yikes.
Yeah. So what else do we have here? So as far as those, there are topical forms, that you can take that are definitely less invasive and aren't going to affect your kidneys as much and all that stuff. So that would be preferable.
If you get a cut or something on the surface of your skin.
Yeah.
Right?
So those are, so there's, and also, if you have like arthritis in your knee, there's some of those topical analgesic type things you can put on, which is preferable to ingesting it where it's going to affect your organs. Yeah.
I know we're wrapping up here because we're going to make this a short one today, but I'm wondering why we as a society, there's a bigger question. Why do we want an instant answer for a problem that may require some time, may require some exercise, may require some changes in our lifestyle or whatever here, rather than address those, give me the pill, get the problem, go away. Even though the pill may have some side effects like you're talking about here.
Right. Well, people do want a quick fix. and they are trying to avoid those, side effects of other things like opioids, like you're talking about.
Right.
But there are some options. So let me go just through a couple of those. So obviously there's exercise, and I'm biased because I'm a physical therapist. Physical therapy is another thing that you can do, and they show CDC guidelines even say that exercise is as effective as medications for many pain conditions.
Really?
So, yeah, and even research shows that aerobic, aquatic, and resistance exercise reduce pain and improve function. And the advantage, obviously, if there's no side effects with those.
No.
So
the side effect is you got to get off your backside and
go
do it.
Yeah. Well, there's one thing you can do that doesn't require that. If you do mind-body approaches, so mindfulness. I'm sure you've heard that.
I hear a lot of people talk about
big term, mindfulness meditation. We'll go into that at a later date. But basically, doing mindfulness meditation, cognitive behavioral therapy, those kinds of things can also be effective for chronic pain. So we just want to do everything possible, like these approaches, including deep breathing and things like that, to help reduce your blood pressure, reduce cortisol in your body, and to improve your conception of your pain experience.
And was it you in a previous episode we were talking about the whole idea of where pain comes from and how?
That was my twin brother. But it was me. Yeah.
Yeah. I mean, because that was something I've never heard of. The pain is coming from your brain. So the idea is that maybe somehow your brain can be used to.
Right. So pain is processed so that all the sensations in your body are processed in your brain, and so your brain is actually it's an output of the brain, not an input.
Yes.
If that makes
exactly.
Sense. Yes. So then there's omega-3 fish oils. Those things are good too. So some of those things can help with dealing with pain. Turmeric, curcumin, those are natural things. It's like a yellow, spice.
More and more I see that, is it turmeric or turmeric, whatever you say it.
I'm not
like
sure.
An Indian spice.
I say turmeric, but
right.
Yeah.
It's like an Indian red spice or something.
Yeah. I think it's mostly yellow, but in the pill you're not going to know anyway. But taking those can also be helpful, especially when it's combined with black pepper, the coumarin, the
cayenne or
turmeric, and the curcumin is the other name for it. Can be effective for inflammation as well.
Actual spices can help deal with inflammation.
Yeah, definitely. Yeah. So basically, in a nutshell, we want to do everything possible naturally. We want to, regular exercise. If you need it, acetaminophen, which is Tylenol, is preferable. If you're going to do NSAIDs, topical form is preferred. Fish oil and turmeric supplements can be helpful. And then physical therapy and mindfulness training as well.
If you're going to take the pill, don't take it forever.
Right. Exactly. Yeah. So in all these, always consult your doctor. I'm not making recommendations here. I'm just educating the public.
Making aware of studies and for educational purposes only. As we always say, go talk to your doctor about these things. If you can get them to sit still for more than 5 minutes.
Yeah, exactly. So the goal is basically getting as much relief as you can naturally, and trying to avoid these things that are going to actually be detrimental for your maximal healing in the long run.
Okay.
Yeah.
How do they reach you if they want to talk more about what you do?
So I'm at Physical Therapy and Balance Centers in Lake Forest.
Spell it.
That is FYZICAL.
Okay.
And you can call us at 949-716-1800, or you can reach us on our website at www.physical.com/lake-forest.
Go see them. I have, and you'll get more than you bargained for. Not just some exercises and some analysis of where the pain and what the problem is, but they'll talk to you and spend some time with you. That's what always amazed me. So
we'll do it. Yep.
Check it out. All right, good stuff. Well, we'll see if we can digest this, and we'll look forward to more of these conversations coming up here.
Thanks, Paul.
Well, there you have it. One more reason to tune in. Health can be simplified. That's what we try and do here. On this show, a simple guide to a healthier life, right here in Orange County's only community radio station. OC Talk Radio, streaming live from our studios here at the University of California, Irvine's Beale Applied Innovation.